Hello and welcome. We're not going to discuss how to brush your teeth. However, we're going to look at the automotive industry and its concept of maintenance to explore if you are more likely to be a consumer of sick care or healthcare. Let's dive in. You are watching HealthWealth. If you're new to this channel, welcome. If you're not, nice to have you back. Let me ask you what comes to mind when you think about bacteria. You may certainly know that they are extremely small and quite abundant, and you need a microscope in order to see them. You may also know that these bacteria are responsible for the daily plaque buildup on your teeth, and therefore we require, as annoying as it may be, to brush regularly our teeth. Bacteria tend to multiply rapidly, especially under the right conditions and if they are properly fed. Bacterial growth can resemble an exponential growth curve if one bacteria divides into 2, 4, 8, 16, and so on. You get the point. Teeth are the hardest material formed by our bodies, and I think that makes them superheroes. However, just like any superhero have their kryptonite, so do our teeth. As we eat and drink, we're not only feeding ourselves, but also the bacteria residing in our mouths. And to thank us for it, those bacteria thrive and happily multiply in our mouths, forming biofilms on our teeth, which we feel as plaque. And you guessed it, the trash they leave behind is what? Acid, which damages our teeth. Considering how small bacteria are and how rapidly they multiply, I am still amazed that within a few hours after brushing our teeth and eating our foods, we already start to feel the plaque buildup again. Also, bacteria have solved the difficult problem of adhesion in a wet environment. If you ever had braces when you were younger, you probably remember that your dentist had to properly clean your teeth and then dry them before gluing on those little brackets. Have you ever tried to glue anything underwater or when it is wet? There are a few other creatures who have solved the problem of adhesion underwater as well, such as barnacles, which you may sometimes see at the seaside. Fortunately, the bacteria forming biofilms, that is, plaque on our teeth, do not adhere as badly as barnacles do, and regular brushing can easily remove the plaque. So let's find out if you are a consumer of sick care or a consumer of health care. If you're like me and you own a car with a gasoline or diesel engine, you're probably as annoyed as I am about the regular oil changes. As annoying as it may be to hand over your hard-earned money for somebody to change your oil, I am sure nevertheless you'd stick to the oil change intervals quite regularly. You prefer a regular, though smaller expense in order to keep your engine running rather than not changing the oil at all, driving around forever, and then surely risking that your car inevitably will break down at the most inconvenient time, such as 5 p.m. on a Friday on the highway. So, if a toothache is the equivalence of your broken down car due to the lack of maintenance, then you'd be a consumer of sick care because you seek repair services, rather than seeking health care, which is in fact more or less preventive maintenance in the example of dentistry. The stakes are arguably much lower when considering fixing a cavity in comparison to a more life-changing event such as a heart attack. So if you only see your dentist when your tooth hurts, then you're definitely in for the repair, rather than regularly visiting your dental hygienist for maintenance such as deep cleaning your teeth, removing tartar, etc. Our teeth are easily accessible. Just open your mouth and have the professionals take a look under the hood, so to speak. Compare that, for instance, for the extra hassle to get a colonoscopy. If you then factor in that preventive maintenance is generally much less expensive than fixing big problems in the end, it should be a no-brainer to take really good care of your teeth. Additionally, did you know that maintaining good oral health has benefits far beyond your mouth or your teeth? Even if you brush your teeth regularly, over time, tartar will start to build up on your teeth. Unlike plaque, tartar sticks severely to your teeth so that it cannot be removed with a toothbrush. Think of the barnacle example cited earlier. Only your dental hygienist has the proper tools to remove tartar. If it is not removed, it provides ideal hiding places for bacteria, and eventually you may end up with inflamed gums and risk losing your teeth. If you then consider that bacteria from your inflamed gums may enter into the bloodstream and from there migrate elsewhere in your body, for example to your heart, you may end up with a life-threatening condition called infective endocarditis, where the bacteria from your mouth inflame your heart valves. I am sure that you agree with me that this is a situation that should be easily preventable, given how easy it is to access your teeth and have your dental hygienist regularly clean them. Furthermore, when you consider that doing preventive maintenance is far less costly than fixing major problems down the road, you should be inclined to take really good care of your teeth. If you enjoyed this episode, please consider liking and subscribing to my channel for more content on the transformation of healthcare, the challenges this industry faces, and for inside views into what it is like to work in the healthcare industry. In future episodes, we continue to explore the relationship between health and wealth-related topics. Join me in the next episode where we explore the hypothesis gut sugar, gut tea, no brush, no problem.